What is shoulder impingement? This is an extremely common cause of shoulder pain. So what signs and symptoms should you look for? And what treatments can help you overcome it? My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, you may not have heard the term shoulder impingement, but it is a very, very common cause of shoulder pain. We used to use the term bursitis or tendonitis, which are very specific causes of shoulder impingement, but overall shoulder impingement is a category of problems that is very common. Essentially what it is irritation or inflammation or aggravation of the rotator cuff tendons as they run under the tip of your shoulder blade. They come off your shoulder blade. It's not really showing it well here, but off the back of your shoulder blade or one in front. They run under the tip of your shoulder blade and then attached to the ball of the ball and socket joint. And they get irritated or impinged for a variety of different reasons, but it's with specific, usually overuse injuries, reaching up overhead, out away from your body or behind your back. So a lot of times in younger people, you see it in people that do a lot of repetitive overhead activities, like manual laborers, people that are constantly doing things, especially with weight overhead, or you see it in a baseball pitcher or some sort of throwing athlete, or maybe somebody that plays tennis a lot and is doing a lot of tennis serves. But very commonly that tendon is aggravated or inflamed, or maybe you have small little area of degradation or tendinopathy or tendinosis within that tendon, but the tendon itself is for the most part intact. Now, the symptoms of rotator cuff impingement are similar to a rotator cuff tear, where one of those tendons is torn, with a little bit of a difference. With impingement, typically you're going to have pain with things that aggravate it. So pain reaching up over the head. Maybe it's getting something out of a cabinet or doing something with your hair. Pain reaching out away from the body. Maybe getting a carton of milk out of a refrigerator. Pain reaching behind your back. So maybe tucking in your shirt or reaching back to put on a seatbelt, something like that. Those would be very common. With a tear, though, typically you'll have pain with all of those and weakness with those activities. But with impingement, especially when the orthopedic surgeon goes to examine you with all those different rotator cuff tendons and muscles, you'll actually have strength. It just hurts to do it. Diagnosis typically involves not just that physical exam, but sometimes getting an MRI to make sure that that rotator cuff tendon or tendons that make sure there's no tear going on. If there's no rotator cuff tear, this almost always does not need surgery. By far, the best way to get through this is doing work with a physical therapist, strengthening the muscles around the shoulder to take pressure off that area, especially with your activities. Maybe a short period of time avoiding those activities usually is enough to get it better. In the past, we used to use a lot of cortisone shots to calm this down, and a lot of orthopedic surgeons still do. I have serious, serious concerns about that. Yes, it can give you a short period of relief, but it's doing nothing to treat the underlying problem, so eventually it ends up coming back. But worse, we know that steroids like cortisone tend to weaken the tendons, and I would argue, and I think studies have shown this, make you more likely to suffer a rotator cuff tear down the road, which then means surgery, but also the success of that surgery goes down if you've had cortisone shots. So I'm not a big fan of that. Would some of the regenerative treatments like the penisin polysulfate to limit the inflammation be helpful? Potentially. Would something like PRP be helpful, platelet-rich plasma, to help calm that tendon down and maybe get it stronger? Potentially. Other, exosomes, stem cells, all of that potentially could help. Again, those are all considered experimental or used off-label, so I'm not promoting that. I've done videos on all these different treatments on my video channel. Click that, subscribe to the video channel and look through all the different videos. You'll definitely find those and you can get more information. Could play a role. I'm not sure that that's necessarily needed, but potentially could be helpful. Again, rotator cuff impingement or shoulder impingement, very, very likely to get better without any kind of surgical treatment. Good one to find a really good physical therapist, somebody that rehabs athletes and active people. They should be able to help you get through this and avoid surgery. Now, I'd love to hear your experience with your shoulder injury. Leave those in the comments below. Just understand I can't offer you specific medical advice, but I can try to answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video, and be notified when I start my next live stream, including my Ask Dr. Geier live shows. If you have shoulder, knee, hip, or some other bone or joint pain, and you want to get significantly better in the next 30 days without cortisone shots or surgery, learn more about working with me in the description below. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.